Hello, I'm Jean-Pierre Mobasser. I'm a neurosurgeon with Goodman Campbell Brain and Spine, and today we're going to talk about sciatica. What is it, how do we treat it, and what are the different options? To start with, I brought a model in. This is a model of the lumbar spine, and what you're looking at is this is the back of the spine where the spinous process and lamina are, and the sacrum or tailbone. This is the front of the spine, so you can see the discs in between each vertebra, along with the nerve roots as they exit the spine. A nerve can get pinched in two different places in the lumbar spine. It can get pinched in the central canal, and that would be from a disc herniation typically. It could also get pinched as it exits the spine, and this is called the foramen. And this could typically happen either from a disc herniation or facet disease as the facets get bigger, such as arthritis. The sciatica complaint that people have is when these nerves, the L4, L5, S1 nerve roots are getting pinched, and typically what that will do is cause pain down the back of the leg or the outside of the leg. In general, the S1 nerve root innervates down the back of the leg through the hamstring and the calf, and the L5 nerve root innervates the outside of the leg into the top of the foot. When this occurs, it can be painful primarily, but it could also cause numbness and weakness. The S1 nerve root weakness would specifically manifest itself with calf weakness, and so that's one of the distinguishing factors we use to figure out which nerve is involved. The L5 nerve root innervates the extensor hallucis longus, and that's the muscle that lifts the big toe up. So these are ways to distinguish which nerve is involved. Once we've figured out which nerve is involved, then we look at the MRIs and we see, is there compression of one of these nerves, and does it correlate with the patient's complaints? Once we've figured out which nerve is involved, how symptomatic it is, then we decide on a course of treatment. If the pain is the main issue, then we try conservative measures such as physical therapy, anti-inflammatory medication, rest, activity modification, massage, and sometimes chiropractic care. If there's more than pain involved, such as weakness or dense numbness, that may change how aggressive we are with the conservative treatments, and we may act quicker because we want to avoid the possibility of nerve damage. In those cases, we may progress more quickly with injections into the spine, and if these fails, we may consider surgical intervention in a more urgent fashion, depending on the degree of weakness or the degree of numbness or the progression of those symptoms. In general, a lot of these symptoms that people have can get better with time and these conservative treatments. If that doesn't work, then we look at the surgical alternatives. If there's a disc herniation pushing on the nerve, then removing that fragment of disc can provide relief from the symptoms. Depending on how long the pressure has been on the nerve and to what degree that pressure has been there, the pain may resolve quickly, or it could be more gradually, and sometimes it may never completely resolve if nerve damage has occurred during that period of time when the nerve was under compression. If it's a disc herniation, these can nowadays be done in a minimally invasive fashion through smaller incisions and less muscle dissection. And if there's a hypertrophic facet joint, which means an enlarged facet joint that is pushing on the nerve, then we can remove that part of the joint that is crowding the nerve and unpinch it in that manner as well. Sometimes these symptoms will come from something more significant, such as instability. The term we have for instability when the vertebral bodies are out of alignment is called spondylolisthesis. If that occurs, then you may need a bigger procedure done to fix this, such as a spinal fusion. Whether that's done anteriorly through the front of the spine, posteriorly through the back of the spine, or laterally, all three are options. Some surgeons have their own guidelines as to why they would choose one surgical approach over the other, and sometimes it's due to the anatomic considerations of the spine itself and what may be the best approach to decompress the nerve. Obviously, surgery is a last alternative, but you also don't want to wait too long until a point where you have nerve damage, and then the surgery is less likely to be beneficial. It's the surgeon's job to figure out, are you at a point where we need to progress to surgery more urgently, or is this something we can take time with and try these conservative treatments and give the chance a nerve to recover? Everybody's individual situation is different based on a lot of factors, so trying to compare what you're having compared to one of your friends, family, or neighbors is comparing apples to oranges. That's why you may get a different answer from one person to the other as to what is necessary for their particular problem. In general, we treat pain conservatively in mild numbness and mild weakness and try physical therapy, injections, medications, and all the things that we've talked about. If somebody has more severe weakness that results in significant problems with walking, we may proceed to surgery in a more urgent fashion in order to get the pressure off that nerve so they don't lose that function permanently. There's a lot more depth and detail to this, but this is just a summary of what sciatica is and how we treat it. Thank you.